Hello, I'm Dr. Frances Pitsillis. What is estrogen dominance? It's a term that I use and researchers and experts use to indicate that there isn't enough progesterone in the second half of a menstrual cycle. And experts say that there isn't enough luteal support. Luteal, that's the name given to the second half of the cycle. And this phenomenon occurs when you do get a normal surge of estrogen or even a slightly lower surge of estrogen, but instead of a decent surge of progesterone, it's a bit blunted. That can occur as you move towards menopause in the premenopausal stage. It can occur in endometriosis, in polycystic ovarian syndrome, in women who are stressed because their progesterone's been drained by the body having to deal more with stress and put out more cortisol. So both the ovaries and the adrenals can't muster up enough progesterone to help with the stress. So stressed people get this. It can occur in fibrocystic breast disease, not enough progesterone in the second half of the cycle. It occurs in premenstrual syndrome. It's part of what can cause premenstrual migraine, premenstrual anxiety, a lot of symptoms around the period and before the period, and it's associated with worry, anxiety, and poor sleep, and breast tenderness and irritability, and heavy, painful periods. So estrogen dominance has a lot to answer for, and the conventional treatments of all these conditions that I've just mentioned include drugs, hormone suppression, the contraceptive pill, painkillers, sleeping pills, antidepressants, etc., when the person could just be given progesterone. And I don't mean synthetic progestins, I mean micronized progesterone, which I'll be giving you more information about in another video. So how do you approach estrogen dominance? Well, the first thing to do with all of these conditions that are related to estrogen dominance is to put that condition into context of that person and their diet and their stress, and do they need a little bit of support for their cortisol, which you can do with herbs. Do you need to help them sleep? And progesterone is going to be great in the second half of that cycle at reducing worry, breast tenderness, premenstrual syndrome, heavy painful periods. It is used for endometriosis, it is used for polycystic ovarian, it's used for anxiety and depression. And so you're just going to give them some micronized progesterone, which is the natural progesterone that we use. Now, where does progesterone come from? Well, your own body makes it from cholesterol. So a lot of it is made by the female ovary premenstrually, and some is made by the adrenal glands. And it's a 4-ring structure, just like cholesterol, just like vitamin D, just like estrogen and the other hormones. And it is the same as your own body, and it's made from wild yam or soybeans in a factory, basically, or in a compounding pharmacy or in a drug company. So it's made in a factory. How does that compare with what doctors call progesterone? Well, doctors were trained in the era where they called all progestins progesterone, including synthetic progestins as well as progesterone. And some doctors only think about progesterone as being a synthetic progestin, like the ones that are put into the contraceptive pill, and like the ones that are used in some hormone replacement therapy regimes and by some doctors to control someone's period. However, these progestins do not have the same profile as micronized progesterone. Some of them are bad for the heart. Some can cause blood clot. Some cause depression and acne because they might have more androgenic side effects. So when people are talking about progesterone, you need to clarify with them, are you talking about synthetic progestins, like in some HRT regimes and in the contraceptive pill? Or are you talking about the natural, the same as in my body, micronized progesterone? Because sometimes my patients see other doctors who assume that I'm giving them, because it's progesterone, synthetic progestins. And then they say, you mustn't take this because it causes this, that, and that, and that. Mistakenly. So we really need to clarify this. And the profile of micronized natural progesterone is that it protects the heart, it protects the brain. You'll hear more about this in another video. And it actually normalizes blood clotting. It is the safest progesterone to use for your body and for your health.